Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Marie Warda and Kristine Lindahl, health educators from MVP Healthcare. Welcome to the show, ladies.
Thank you, Peggy.
Marie, can you start by talking about what you do for MVP Healthcare?
Sure can. I am a community health educator with MVP Healthcare. We do programs and provide education and resources all across the entire capital region. We do programs both for community groups and for our members, and we certainly want all of our members in the general community to take on life and live well.
Kristine.
I am also a community health educator for MVP Healthcare in the Health Promotion Department. And Marie has pretty much verbalized everything that I do as well. We also offer a number of ongoing fitness classes here in the Capital Region, in addition to all of the presentations and programs.
Okay, and this presentation is actually a shortened version of one of your long presentations that you do.
Correct.
How long does it usually last?
Usually, most of our presentations are about an hour long.
Oh, okay.
We also do have some programs that are series, but most of them are about an hour long.
Okay, so we are trying to squeeze this into
Yep.
30 minutes. So we better get started. Right? Marie, can you tell me who are our healthcare providers and why is it important to partner with them?
Well, very often when people think about healthcare providers, they think their doctor, and that is not the case. The physician that you typically go to, your primary care doctor, is just one of your healthcare partners. The rest of the partners include the pharmacist, your chiropractor, your physical therapist, it could be your nurse. It's also your dentist.
Right.
We need to look at the whole picture for healthcare providers, and it's very, very important to work together with all of those individuals because they all have a little piece of your healthcare and a great interest in making sure that you maintain your health. So we do need to really recognize that it's not just one person, that it's really a team effort, and you're also part of that team. And it's important that you work together and share information between all those health partners as appropriate.
Right. Kristine, I'm sure that I could even do this, but do you have some issues that you want to mention that people generally have with healthcare providers?
Well, certainly, Peggy. And actually, this list we've compiled from, that we've done this program in many different venues. This is really a list that's been compiled about issues that come up over and over again. So these are issues for many people. One is it's hard to get an appointment. That's kind of right up there. Long waits that's another issue. A long wait once you get to your appointment. And then a big one for many people is feeling very rushed, actually, once you get in the examination room and have that time with your provider. Another big one has to do with communication. And this has a couple of different focuses. One is understanding the kind of clinical doctor speak, the language that's used. And then another communication issue that comes up is sometimes one's provider is from another country, so there is a heavy accent issue. So sometimes, there's a difficulty in understanding what they're saying. So those are two. And then I think another piece of the communication, or another part of the communication piece, is people sometimes feel that their provider's not listening to everything that they're sharing with them. So that I think is all wrapped up into communication, and things like sometimes people have a somewhat negative response to being told, oh, your symptoms are just because you're getting old, or you're a hypochondriac. Those kinds of things. That has come up a number of times. Also, people, have an issue with not getting a return phone call, for instance, if there are test results or if they've called and left a message to get an appointment. So sometimes that can be an issue, just
Right.
how timely having a return telephone call comes. And then I think another major one for people is, and this I find interesting, that people have an issue with sometimes with their provider being so prone to just prescribing medications rather than really going into some discussion with them about recommending lifestyle changes.
Right. Instead of quitting smoking, instead of
Right.
losing weight, which are kind of the elephant in the room, they don't even talk about.
And that is true some of the time. Yes, absolutely.
Okay. So you have some solutions for some of the problems that you've mentioned.
Well, yes, and these are really things, again, with these audiences that we have, we brainstorm this together. And so let's see, first of all, making an appointment. I think that, Marie talked about it at the outset. When we think about this as a partnership, it's also really understanding, well, I'm one of the partners, so I need to be proactive. Mm-hmm. And there's some things here that we're discussing today that really are they're just kind of the nature of the beast. There are, the doctors are busy and lots of stuff is going on, and it's going to take a persistence, I think, on our part to kind of stay with it until you make an appointment. Sometimes it's going to take longer than we would like, but just stay with it. Stay with it. Now, in terms of waiting, that's kind of another big theme. Again, a little bit can be the nature of the beast with what we're talking about here.
Right.
So be prepared for that. Take some good reading. That's one thing. Be prepared to use the time that you're in the waiting room well and in a way that feels good to yourself. Also, though, again, from the standpoint of being proactive, be communicative about, you can go to the receptionist and just talk about, the fact, remind them that you're there and, get an idea of how long it's going to be. Be communicative about this. You can even be communicative with your doctor. Once you're in the examination room, maybe discuss with him or with her, is there a time of the day when I can make my appointments
Right.
when there's going to be a less long wait, where the likelihood of having this long wait is not going to be so great. You can talk about these things, and oftentimes there can be a solution to that. Now, in terms of the communication piece, people solve this in different ways. I like to take someone with me, and I know that I'm going into an appointment where there's going to be information conveyed to me that I might be, a little nervous about what's going on. So my chances of hearing all of that and taking it in are not going to be great. I like to have someone with me, so we certainly, suggest that people take an advocate with them. Take notes. There's nothing wrong with having a little spiral notebook that you jot down notes on as your provider is speaking to you. If you don't understand a word, ask for them to repeat the sentence or the word. Could you repeat that? I didn't quite understand what you said. And also repeat back. If your provider has said something that seems a little bit complicated, you think you got it, but you want to make sure that you got it. I'm going to repeat back to you what you just said because I want to make sure that I've understood what you've said and that we're on the same page. That's a way to make sure that you're getting the information clearly and concisely. And then I would also say, if what's going on, if you've been given a new routine to do or a procedure or some kind of treatment, ask if they can put it in writing. Ask if they have a handout that you can take with you so that that's always there for you to refer to.
Okay. I would say, I think one of the things that I wish I could do would be to actually write my questions down before I go and bring them with me.
And that's a very good idea. So it's kind of, you want to use your time to the best advantage, again, because, and actually, you're right, we talked about feeling rushed. So a very good way of dealing with that is to go in prepared. Go in prepared so that you know what is it that you want to cover in that short amount of time that you have.
Yeah, I think that we tend to have this state of mind when we go to a doctor's office that, oh, the doctor's very busy and I'm wasting his or her time, and I'm just going to let them do what they have to do and let them go. But seriously, we need to have quality health care, and we have to tell them what we need.
Absolutely. You remember, you're a partner in this. You're a real important piece, and you can ask questions to get the information that you need.
Okay. So, Marie, you have some tips. Can you please define what Take Part is?
Well, Take Part really has to do with a small acronym with the 4 letters that make up the word part. And the first is to prepare a list.
Mm-hmm.
Again, you alluded to that before. It is very important that we partner with our medical providers and that we know why we're there. There was a study that was done a number of years ago in Rochester, New York, looking at the amount of time that it took at a meeting with a medical provider. At this time, it was specifically physicians. And it was only about 17 seconds before the doctor interrupted the patient for the first time, which that doesn't seem like a lot of time. Well, they did some changes surrounding that. They did a lot of education with new physicians, and that now has increased to 20 seconds.
Okay.
That doesn't seem like a lot of
time. So whatever we have to say,
right.
It's got to be done in 20 seconds.
Well, we don't want this to sound terrible. Our healthcare system actually is quite a good system, and doctors do try to stay focused. But we, as a partner in this whole process, we also need to stay focused on what we talk and why we're at our doctors and what we talk to our doctor about. Okay. So again, preparing a list, making sure that we pick 1 or 2 things of why we're there. We don't want to talk about every ailment that we have unless we're there for a general physical, where you have a lot more time allotted for an appointment. The average amount of appointments are between 10 and 15 minutes, and that's because the doctor has to see a number of different individuals for issues equally as important as yours. So we need to be respectful of the doctor's time, as well as we have an expectation that the doctor will be respectful of ours. Right. So making that list is very important. The next is to ask questions. Again, as Kristine alluded to before, if you're not sure about something, you definitely need to ask the doctor to better understand what they're saying, and ask the doctor what you expect of him also. That could be from, I had a lab test done before I came in here today. When might I expect those answers or the results of that test? Or I'm going to have an x-ray done tomorrow. When will you notify me about that, the results of that? Mm-hmm. Again, asking questions and to elicit the information that you feel you need to have out of that appointment. The other, again, and we may be repeating some of these things, but the R in part also stands for repeating back. The doctor also needs to know that you had a clear understanding of what was said during the appointment. So if you repeat back and what you thought you heard, and it's not what the doctor wanted you to understand, that will give the doctor an opportunity to clarify with you the information that you heard. Similarly, it will give you an opportunity to clarify to the doctor what you know you heard.
I would say generally the doctor or healthcare provider doesn't ask you to repeat something to them, so you have to really have the courage to do that.
Exactly. Although physicians now, we're finding that more and more, that they are also asking their patients to become more active participants in the process. The other thing is taking action. Doctor can tell you what needs to be done, tell you what's wrong with you or right with you, and may also suggest certain things for you to do. Mm-hmm. But unless you respond to that and take action and follow the instructions of the doctors, it really puts the whole partnership on a one-sided basis. So if your doctor says that it's really important for you to start exercising or to eat healthier, and you make a conscious choice not to do that, well, you can't expect the results, the outcomes to be what you want them to be, because you have to be a participant in the process. So if your doctor suggests that you take an antibiotic and that you take it completely, even if you're feeling better, that's very important, because by stopping an antibiotic too soon, there can be things called, basically you can have some residual effects later on, and the infection or whatever issue is going on with you might take a greater hold. So if you've not followed what your doctor asks, then that really becomes problematic. You're really not in a partnership with your doctor. So that's why it's very, very important.
Okay. Now, based on the small amount of time that we have in this appointment, do you have tips on communication? What should we say and what should we not say?
Okay. Well, again, we've touched on some of them, but I'd like to go over them again because I think they're very important. Very often, we only have a few minutes to spend with our doctor. We need to go in again with a clear and concise reason for being there. It really starts with the appointment. If you call for your appointment and you say, I just need to come in and talk to the doctor, usually the receptionist or the secretary will say, can you give me a little more information? So the doctor will then be able to know if you're having chest pain. Well, first of all, you're going to move up on the
call the doctor.
Right, you're going to move up to what needs to happen.
Right.
If you call the doctor and say, I have abdominal pain, and the secretary says, well, how long have you had that? And you say, for 6 months. Well, it may not be as important as if you said you have severe debilitating abdominal pain for the last 2 hours. They're going to want to see you right away.
Right.
You may be able to delay by a day if it's something that's been ongoing over time. Also, you want to keep the story short.
Right.
You don't want to be going in and talking about your grandchildren and your children and what they've been doing and asking your doctor about the vacation. You want to keep it clear and concise. Dr. Smith, I'm here because I've developed abdominal pain this morning. It's severe and I can't do anything today. I'm in so much discomfort. That's clear and concise and to the point. The doctor then can address that and evaluate you appropriately and get you to where you need to be. Again, keeping your list short. If you do go in and you have more than one thing you want to talk to your doctor about, try to keep it to the 1 or 2 most important things to you today. That could be my blood pressure is really high or my blood sugar is out of whack. Try to keep it clear and concise and try to dwell on the most important things. Making sure also that your list does include other important things that the doctor has to address that day, such as if you're there for a general, recheck appointment for your blood pressure, but you neglect to mention to the doctor that you're out of blood pressure medication.
Oops.
Again, you're going to have to call back and it will only delay you getting your prescription refilled. So again, as part of your list, adding to that what information you really need to have. That can include test results that you didn't get and you want to know what they were. It could be medications that you need refilled, or questions about, when do I need to have a particular preventative screening test. Those are all very important things to add to that list.
Well, and I got to say that being the consumer health librarian here at the Colonie Library, I've gotten all kinds of questions from people where they've gone to their healthcare providers and haven't understood what they've said, but they feel like, well, they don't want to bother them because they're busy. So they come and ask me, and I actually had a question. I'm having brain surgery in 2 weeks, and I need to know if there are any risks for nerves in my brain. Well, hey, I'll give her a book on anatomy, I'll give her a book on surgical procedures, but this is something that the doctor really needs to deal with.
Absolutely. And the point about that is that people make assumptions. If you don't ask, you must already know. And again, that's where we have to be our own advocate, and that's why this is considered a partnership.
Right.
If you don't ask the questions you're unsure about, your doctor will never know that you weren't aware of a particular situation or needed to have more information. In addition, it's also important is if you walk out of that physical office setting and you walk back into the receptionist to make your next appointment and you realize, oh gosh, I wish I'd asked this of the doctor. Ask the receptionist, the secretary, or even the nurse if the doctor could take 1 more minute to ask 1 more question. If he or she is not available, very often there is another medical provider in the office. And we forget about the fact that the office nurse is also a reliable resource. Sometimes they're also able to, how I sort of say, put it in plain English for a patient.
Right.
Very often, physicians sometimes forget, and they do use doctor speak or medical speak,
Right.
and they don't put it in complete English for someone to understand. So it is really important that if you're really not sure, go to the next level. That could be the nurse who perhaps may have additional time they could spend explaining to you about a particular phrase or a test that you're unsure about.
Right.
It's very, very important also, if you really feel that you need more information, that you ask the receptionist to make another appointment as soon as possible so that you can revisit the situation and just have a conversation again with the doctor. Kristine mentioned asking for things in writing. That's a perfectly valid thing to ask for, is if they have a handout sheet on a particular situation.
Right.
When you go to an orthopedic office and you ask them about what exercises can I do for a particular body part, very often they will hand you a piece of paper that you can then refer to. These are all things that are very, very important to make sure that you recognize the whole process and that you're partnering. The last thing I will mention too is very often in your health provider's office, you may also see people called physician extenders. Those can be nurse practitioners or physician's assistants.
Okay.
There are times where you will see your doctor on a particular visit, but the next visit you may be seeing a physician extender. Those are highly competent, well-regarded, medically licensed professionals who are part of your health care team. So it's not unusual for you to see one of those individuals. If there is something that only a physician can handle, they will make sure that the physician is well aware of the situation and will make sure that you do get to see a physician. But there are great opportunities sometimes to see another person to get additional information, perhaps earlier than you could if you had to see your physician directly.
Thank you. Kristine, you have some sharing tips on more communication tips with the healthcare provider. What do you have to say?
Well, and what I'm going to address now, Peggy, is a little bit. This is information that you want to be sure that you share with your physician, and it would be the information that you share when you have your general examination, when you have more time.
Okay.
So it's kind of the big picture constellation of information. Your doctor needs to know not just how you are physically, but how you are mentally and emotionally. You want to be very clear and concise about what is going on symptomatically. If there is something going on, are you having pain? What kind of pain? Has there been fever? Unusual bumps or rashes, things like that. Be as absolutely concise about those kinds of things that you want to address. Right. Have you lost or gained weight and not really known why? Have your sleep patterns changed in any kind of way? Those kinds of things. Your doctor needs to know about everything that you take. Your vitamins, your supplements. What prescriptions are you on? What over-the-counter drugs do you take? Your doctor needs to know about your lifestyle. Where do you live? What do you eat? What kinds of activities do you take part in every day? How active are you socially? What kinds of things do you do? And then also your doctor needs to know what emotional stressors are in your life right now or have been. Loss of loved ones. Have you moved recently? This can be a very big one for our older population who are moving from their their big house to their much smaller independent living apartment.
Lost a job?
Lost a job. That's a big one. Yeah. And that's very, very much present. And also financial woes. Really that can be certainly a big stressor. And our healthcare provider needs to know those things because all of that stress can play into our health, our well-being. And also, your doctor needs you to be honest. You want to be honest about what's going on. You don't want to tell your doctor what you think she or he wants to hear or what you think they need to hear.
Of course I'm trying to lose weight. Of course.
So, we want to be certainly as honest and straightforward as we can. Again, kind of keeping in mind that we're working together here. It's not about right or wrong. It's really about finding the right path.
Okay.
I would love to add to that list. One of the things that we've also talked about, it's very important also that your medical providers know about all the other medical providers you're seeing. And
absolutely.
whether or not you may have had an emergency room visit at some
Absolutely.
time in the recent past or since you last saw the doctor. Very often, especially our seniors who travel out of state, the communication between doctors out of state doesn't happen easily. So they may not get reports if you have taken a fall in another state or taken ill in another state or even in another city, and have not gotten that information, and you've been put on a different medication. So it's really important to make sure that when you go to your doctor that you let them know about all the people you've been seeing since your last visit, and if there has been anything added or taken away in your medication since your last visit. It's one of the things that we do very often forget, and it's very, very important that we make sure that we add that to a list on any visit that we have with our physicians.
Right. Well, we only assume that when you say who your primary care is to whoever's treating you, that they send the report.
Well, you know, in reports, I mean, we really do have a very good medical system in the United States. It always could use improvement. But one of the pieces that's very difficult is because communication creates a large paper trail. And once we do get more electronic records where things are more easily shared, we have to rely on the person in front of us. And, you know, I know sometimes I've had conversations with my own husband who says, why doesn't my primary doctor know what happened to the last doctor or what happened at my last doctor's office appointment? And what I've tried to explain to him is, you know, you're one patient of many. And so it's important that you're in this partnership together.
Oh, so Marie, you have some tips. Basically, what is important to know before you leave the appointment?
Well, I think we've touched on a lot of them, so I will just talk very, very briefly about these. Again, you need to make sure that you understand what the doctor said. Whenever possible, repeat back to the doctor so that you both are clearly on the same page. You need to understand what your role is from this point forward, what preventative measures or what additional testing you need to make sure that you take care of, and when your next appointment might be, what follow-up is appropriate. And you should make sure that you clearly understand all those things and also understand when you may be getting results of other testing and things like that. You want to know what the final outcome was. And if the doctor clearly doesn't have an outcome or a diagnosis for whatever the reason was you were going in there for, find out when you need to come back to review it and you know what he or she would like you to do.
And I would say don't be anxious about, or don't hesitate to call the office.
Exactly.
If you come up with a question an hour later, a day later, yeah, you can come in and ask me for help too in the library. But you know, I think that's one of the things that we have our rights to do.
Absolutely, that is a patient right to have the information. Also, you have a right to your medical records. So again, speak to your physician or your healthcare provider about the information that you need. And make sure you keep your own records too. You want to know when your last immunizations were. You want to know what medications you're currently on. You want to know what your significant health history has been. And it's always good to write that down, keep it in a small card in your wallet, have that with you, because then if you go to a different doctor or with a different specialty, that you can pull that out. And if you're not in a great state of mind at that moment, you don't have to worry about thinking about it. In addition, the person that you may take with you as your advocate will also have access to that information so that you can share it back and forth.
And I would say, being a person that has changed in the past, to also not hesitate to change healthcare providers. If you don't get along with the person, if you don't like the person, you've got to be able to feel comfortable with them.
Right, exactly. And your healthcare provider, as we've said at the very beginning, is a partnership, and it encompasses a lot of different individuals. It's unlike the past when our parents would have gone to a doctor for their entire life, and no matter what the doctor said was appropriate, without knowing the whole picture. Now, it really is a partnership, and that's really how physicians want it to be too.
So, Kristine, you have some tips about making decisions with a healthcare provider. What are some tips on how to do that?
Well, again, it's what we're talking about here is the fact that we have if something's been diagnosed or we have to consider treatment for something, there are choices, there are options, and so it's discussing them. Communication comes back into this. So you want to discuss the choices and options with your providers. For instance, if you've got a chronic condition,
Right.
what are some real management options for that? And kind of go through all of what those are, and then kind of what's going to work best for you. Discuss risks and benefits. We kind of consider these in so many other aspects of our lives. Well, here too, what are the pros and cons of doing this or not doing this? What is the length of the
Right.
treatment going to be? What's the prognosis from after the treatment? What are the possible side effects? And what's the cost going to be? So then, after you've kind of done your risk-benefit analysis, you also want to discuss your personal values and circumstances. How is this going to impact the quality of my life? You want to really discuss that reality, those realities, what some of the possibilities there are. You want to really discuss what the potential financial risk is going to be or impact is going to be in your life. And also you want to really go, I think, to yourself and feel if there are any real barriers that you're feeling, and not be afraid to discuss those. So that, because
Right.
if you feel that there may be some barriers, then you can more forthrightly discuss those, and that can maybe take you to an alternative or to another solution.
Okay. Now, prevention is very important, right? I mean, so I think if we take good care of ourselves, then we're not going to get sick, or we may not get ill, right? What are some of the discussions we can have about taking care of ourselves with our healthcare providers?
Well, I believe all healthcare providers now recognize the benefit of being proactive in preventing health. It's much easier than trying to fix something that's broken. So certainly prevention is what we're all about, especially MVP Healthcare, because we talk an awful lot about preventative measures and healthy
Right.
lifestyle behaviors. So having a conversation with your doctor about what steps you can take to improve your health and to be a partner in your good health. That could be, we talked about before, losing weight. It can be about quitting smoking, how important those kind of things are. It's also important to talk to your doctor about an exercise program. Again, if you've never exercised or have not exercised in many, many years, you certainly do want to make sure that you are physically able and healthy enough to start an exercise program.
Right.
Nobody's going to go out and run a marathon day one, but the doctor may suggest that you start going out for a walk 20 or 30 minutes a day and build up to an exercise routine. Another thing that you can do is, in partnership for your good health, is to also partner with whoever your health care plan is.
Right.
Certainly MVP Healthcare has a number of programs around the capital region that will help you improve and maintain your lifestyle, from all the physical activity programs that we have to the programs that we do from an educational perspective about
Right.
nutrition, those kind of things. So it really is a partnership. And we certainly hope that people will recognize that you're not here to be taken care of, but you're here to also take care of yourself.
Great. And read the newsletter that the HMO sends you, right?
Yes, yes.
Because it'll
MVP
tell
has
you
a-
everything.
That's right.
Absolutely.
Now, Kristine, we don't have time to actually go through the questions, but we are going to run a list of questions after the show, basically before the credits. They deal with symptoms, and it's a whole list of questions dealing with how you deal with symptoms, medical testing, and medications. And if our viewers can't catch everything at the end of the show, they can contact you, or they can contact me and get the list of questions from us.
Absolutely, yes.
So let's
Yes.
mention the website and the telephone number, please.
Okay, our website is www.mvphealthcare.com, and please call me directly for more information about our programs all throughout the region at 518-388-2485.
Great. Thank you very much for coming
You're
in,
welcome.
ladies.
Thank you for inviting us.
Thanks for watching. We hope to see you next time on Focus on Health.